Cassandra Freison, Advanced Practice Nurse, Long-Term Care Physician Services, on behalf of Fallkville Healthcare Center's Administrator, Ms. Melba Freeman, and Director of Nursing, Ms. Joan Walker, and staff, we present to you our best practice road to quality improvement from alarm-free to falls reduction in long-term care. We will begin with a pretest. If you can just think about the answer to these questions in your mind, and we will address them again at a later time, towards the end of the presentation. Number one, alarm placement is an effective fall strategy to prevent falls in residents. Number two, care planning for alarm-free to reduce falls in residents should involve an individualized fall risk assessment. And number three, providing safety to our residents is the responsibility of nurses. Let's look at the impact of falls in nursing homes. According to the CDC, 75% of residents ages 65 and older fall each year. Many of these falls are recurrent falls that average 2.6 falls per person per year. Many of these falls are injurious falls that can result in fractures and even death. The results of falls in nursing homes: residents may have disability, functional decline, a decreased quality of life, and ultimately death. The cost of a fall for adults 65 years and older, according to the CDC, the total annual cost of falls, including fall-related mortalities, in the year 2000 was over $19 billion. It is estimated to increase to more than $54.9 billion by the year 2020. There are conflicting views in regards to alarm placement versus alarm elimination in decreasing falls in long-term care. However, the positive views of alarm elimination seem to outweigh the views of alarm placement for falls reduction. According to one 30-bed dementia long-term care unit in Connecticut, it was reported that patients who were agitated and restless were much calmer since the elimination of alarms. According to a nursing and rehab center facility in Connecticut, there was a reported 15% fall reduction rate after becoming alarm-free. A 45-bed unit at a Jewish rehab center in Massachusetts reported a 32% decrease in falls, below the average quarterly fall rate after removal of alarms. And in a recent study in the Annals of Internal Medicine based at a Tennessee hospital found that alarms were not statistically significant in reducing fall rates. Therefore, the question is there any evidence base for alarm use to prevent falls and injuries? According to Ms. Ann Spinard, geriatric specialist and vice president of operations for Connecticut Medicare Quality Improvement Agency, there is none. Therefore, Fallkville Healthcare Center has become an alarm-free facility. What does alarm-free mean? Alarm-free means, according to Connecticut Health Investigation Team, residents at risk of injury, usually from falls, are no longer outfitted with detectors on their mattresses, chair pads, and clothing, and I would add wheelchair and floor mat, that emit a warning signal when they try to get up and move around. Fallkville Healthcare Center is a 112-bed facility, 59-bed dementia unit, type of care provided, subacute, long-term, and dementia care. Care plan meetings are held weekly, and after each fall event, QA meetings held monthly. The type of alarms previously used included stringed pool alarms, chair, bed, wheelchair alarms, and floor mat alarms. Education is a big component of the alarm-free approach. Education not only of the staff, but residents and families. It is important to note that in addition to our alarm-free approach, we have multiple fall prevention strategies that are used in combination to elicit a significant fall reduction rate. At this time, we will have a day in the life of alarm placement in falls reduction at Fallkville Healthcare Center.